who was asking, who are we, where are we, and where are we going? And I think this is a summary of the current state of the pandemic. And there have been different aspects. Nick Ogden alluded to the early stages of the pandemic spring 2020, when there was a tremendous interest in modeling, and I think a lot of impact from the forecasting for very simple models and to the mere notion of exponential functions and flattening the curve in one way or another. And so the popular science magazine in Quebec Science, had a feature calling that period the golden age of mathematical modeling, because people were discovering exponential curves, and there was even someone who put on his Twitter feed that the number of people looking at exponential curves was itself exponentially growing. So a number of issues were then discovered, and I think many of them were alluded by the previous speakers. So what we'd like to do in the coming panel is having one of the speakers and two more panelists to discuss some of the issues. And let me first introduce the two new panelists. So Nick Ogden, that I introduced before, will be with us, and Peter Juni is another one, and Kim Simmonds. So Peter Juni is professor of medicine at the Department of Medicine and professor of epidemiology at the Institute of Health Policy Management and Evaluation at the University of Toronto. He's a graduate of the Faculty of Medicine at the University of Bern in Switzerland. He was a research fellow in the Department of Social Medicine at the University of Bristol. And since 2020, March 2020, he has worked on clinical trials, observational studies, basic research, and science communication related to COVID-19. And since July 2020, he served as the scientific director of the Ontario COVID Science Advisory Table. Yes, I see him. And Kim Simmonds is a senior manager at EY. She has a PhD in public health sciences from the University of Calgary. She was the co-lead of COVID-19 modeling in Alberta, reporting to the chief medical officer of health to prepare a briefing to the cabinet. And she was a key knowledge translation expert between the chief medical officer of health and the modeling groups. She's a modeler, and she was part of the decision process. So we hope she will share with us a unique perspective on the role modeling played in that process and the associated challenges that they entail, I believe some of which have been alluded to previously. So to the three panelists, if I remember my time as an administrator in many of the discussions on status of things, the two key concepts were lessons learned and best practices. So can I ask each of you to give us briefly what you see as two examples of the best practices and the lesson learned from modeling in this pandemic? Let's start with Kim.
Nothing like being put on the spot. So hi, everyone. Thanks so much for having me. So I'll talk a little bit about the Alberta experience, but also I've had the opportunity to talk to actually quite a few of you about modeling across the country and some things that maybe have worked and haven't worked. So in terms of modeling, the 4 T's that I've come to understand that make things successful are trust, time, transparency, and team, which sounds really cheesy, but I only remember things in simple terms. So the best thing that I learned was to have trust. And as soon as there was trust between decision makers and the modelers, there was success. And so at the very beginning of COVID in March, where Nick talked about that, and February, there was a high degree of trust because there was no one else to go to. And there was a lot of collaborative working together, and that team piece really came together between a whole bunch of different groups, from clinicians, modelers, physicians, and it worked really, really well. And I think there was a transparency even between the modelers about what they knew and what they didn't, and how much uncertainty there was. Over time, in Alberta and in some other places, that's eroded some of the trust that's existed. So in terms of the best practice, and I'm in Nova Scotia right at the very beginning, they told me a story about how they sat down with the minister for an hour, which is something most people don't get a chance to do, and walked through what modeling could and couldn't do, and laid that foundational piece, and that built the trust between the analytics group and the politicians. So I think that's probably one of the key things, if there was that time to sit down and explain things so that there wasn't miscommunication along the way, that would be kind of the biggest thing that that I've learned, is it, as soon as we don't make the time and we don't have the trust, then it doesn't matter how great the model is, it doesn't matter how precise the output was, any of those things. I think you're kind of lost when you're working between decision makers and modelers. And then in terms of best practices, I saw a lot of places in Alberta and others that use different types of models to answer different questions. And I thought that that was really good to try and get the public in general to understand like what things, how things, what you could use a forecasting model for, what dynamic models did, and how those kind of worked. But I guess for intro remarks, that's all I really had to say about that. But I'll hand it over maybe to Peter, unless I'm taking over Jack's job, and answer questions if anyone has any, or however the panel works.
I'll ask for Peter.
Yeah, so I mean, it has been a humbling experience. And, you know, when I start, I just need to make very clear, I'm an epidemiologist. I can't claim to be a mathematical modeler, even though I tend, that's just my nature, to get involved more and more into everything I'm doing. So that's why people think I'm a statistician. I'm not. I think the really important part here from my perspective was just to be as transparent and as honest as we could, which sounds trivial, but it's actually not. I remember very, you know, come to mama moments when a journalist asked me a question and I knew I'm either truthful now, not polarizing, but truthful, or all we've done so far is just for nothing. It was just so important to be at every single moment, just be truthful and be transparent. What we're telling, or what my colleagues, you know, Beate and Steini are telling the decision makers, the public needs to hear the same. And if we need to bear bad news, we need to do that in a non-polarizing, non-dramatic fashion without blaming, etc., but still talk what this is all about. No? And I think that was really, really important. That was one of the, you know, of the lessons I learned, which was important. And the other one was how I'm a clinical epidemiologist originally, so I'm doing all these trials and meta-analyses, etc. And I basically could throw most of that just away. You know, was just forget it. We don't have this level of evidence ever. And some of my colleagues never understood that. We still have a few, EBM people out there who are EBM is an inherently conservative field, who pretend we have time to figure that out, even though the pandemic is just rushing through, you know, time and the population, and we can't do that. So I completely had to change the way I approach this and wear my patient hat and just say, I need to triangulate everything we're doing, but really everything, because the parameter space we're working in, or that, you know, Kim and Nick are working in, it's not a space from minus infinity to plus infinity. We can always narrow this down, and it is important to do that, but we can only do it if we really use all the evidence that we have available and brachiate like monkeys ourselves through the pandemic. You know, we needed to start, for example, with the alpha wave to understand severity in the absence still of vaccine rollouts or you know, fundamental vaccine rollout at the beginning of the alpha wave. and then just brachiate our way through to the situation now to understand severity of disease in the vaccinated and in the unvaccinated. And we need to use all sorts of tools to triangulate, the situation we're in, as beautifully shown by in several presentations. For instance, wastewater that is becoming so important. And I know one of the first things I just touched when I became director of the science table was wastewater. And here we are nearly 2 years later, and we start to use it. So this part that we just don't have time to be perfect, and we just need to use in a very realistic and pragmatic way all the different data points from biology to observational evidence to just the various pieces of information. That's really important, so that we start to have models that just have plausible ranges for the parameters they're using. Otherwise, we will always say, not a clue. Yeah.
Thank you. Nick?
Thanks, Kim and Peter, for those points. I guess maybe if I start with the lessons learned from, and that is very much to my kind of thinking and involvement in the this network of modelers, is actually being able to think ahead and plan and have things in place. So lessons learned: don't try and build the plane while you're trying to fly it, which we had to do with this, both in terms of actually building the models and also building the systems whereby how does the information get up to decision makers, as Beata was talking about, and of course, yes, trust, which means that there has to be kind of middle people who are capable of translating the information produced from modeling to those who need to understand the implications for policies and programs. And that is kind of like I think it's a bit of a jack of all trades, master of none kind of skill, except perhaps the capacity to be able to communicate. Trust is also about about modeling best practices. Modeling has gone from something which is a kind of almost esoteric mathematical discipline to something which is central to deciding on what happens with public health. Because if you do this, this number of people will get into hospital, will suffer this. And that happens because they are detailed enough. They are detailed enough, they have enough biological reality, which is of course a challenging in modeling, because the more biological reality, the more complex, the more likely you've got some kind of an error there, the more, so that's in itself a kind of a public health modeling challenge. But nonetheless, what has happened, I think, during this pandemic, just that trust building thing, that the models are actually saying pretty accurately what will happen if you do X, Y, or Z. So, and not just one time, but time and time again. And again, and that comes down to the idea that the models are grounded in reality, and they're grounded in reality via data, and from numerous sources of data. Now that includes the surveillance data from hospitalization, data from hospital, a lot of which in Canada we've actually borrowed from elsewhere, because in other countries there may be better connectivity, public health and hospital data and so on. But it's also down to the feeding models with knowledge synthesis, products of knowledge synthesis teams, so that we really are at the forefront of our emerging knowledge about a challenge. And without that, we would have been blind. So yeah, but that's, I guess, my my main points on lessons learned and best practices. But lessons learned, I think, is very much a thing that that we have to plan for the future. We really have to look at them. We're only just starting to really sit down and think. So
let me start with this very last sentence on how do we prepare and actually exploit the lesson learned and best practices. One of the difficulties that came up, as Peter mentioned, is that the notion of availability of data and evidence-based decision-making or data-based decision-making does differ from a context to another. And some people are used to have less and less of data and time to make decisions. And this is what some mathematicians call the paralysis of analysis. So at point, that's the one version of perfect is in the enemy of the good. So how do you convince people that, yeah, we have enough data because we have a decision to take? And how do you sort of merge these different cultures, I would say, people on the ground that have to make decisions with very imperfect information, with people with a lab and basically long range grant support that they can generate data before doing the analysis? Is there a way, and let me try to bring mathematical modeling in, is there a mathematical framework or a way to formally incorporate these different cultures, I would say, into building the plane while we're flying it? Maybe I'll go in reversed order. Nick.
I think the answer that I'd first like to make is I'm not sure. I have uncertainty. There is uncertainty in my answer. But I think when we're dealing with uncertainty, when it comes to modeling, I think there has to be a point at which the modeler is honest with him or herself and with the managers. And to some extent, we're there right now with the Omicron wave, where suddenly we're in this situation where we are traveling the most blind we have in this pandemic. Is that we have to say, you know what, we're not going to do a forecast because we don't have the information. When we have enough information, we'll do another one, but not until then. So in other words, we have to be, I think, courageous in not producing products as well as producing them. But I think as far as the planning is the thing that will lead us to a better place than we've been. And that is in all of those things: the data collection, the data linkages, the sharing of the data. Well, we know that is a big to-do thing that we're all aware of. We've all suffered it, so. But then, how that modelling work gets made into decisions. And it may not, unless we have some kind of longevity of the relationship we've had between modeling in public health organizations and decision makers in organizations and our university partners. And I think the only way that is going to happen meaningfully long term is if we have modeling capacity in the public health organizations who are able to talk the language of both groups. So my first point.
Peter?
Jacques, I go into early childhood psychology. I think the most important tool in a situation like that is just a counterfactual argument. And that's really a 5-year-old kid. What happens if you do that? Or what happens if you don't do it? Again and again, when I look at our science briefs, that's exactly what we did. We have a base case and we say, that's the base case. And then we just have the most likely estimate if we do something else. And we show these two. We still have a series of sensitivity analysis. But first of all, we just say, okay, what happens if yes versus what happens if no? Really important. And the other part is not to use uncertainty as a weapon that basically supports the inherent tendency of many people to do nothing, to end up in paralysis. And this means in every situation we're in, we need to ask ourselves, that's again the parameter space, what is plausible and what is not. So right now in the situation we're in, for example, is it plausible for Ontario that the wave we're seeing is a naturally shaped wave that is basically now just dominated by susceptibles being eliminated to an extent that whatever we do, miraculously nothing happens anymore? And that's just wishful thinking, but a lot of people have that. And it is important in this situation to say, wait a moment, if this were a natural wave, then this means right now where we are, if we just use simple models, we already would need to have eliminated roughly 65 to 70% of the susceptibles. And that's impossible. That's impossible by all we know. If we look at everything, including the wastewater signals, including what happened earlier when we still could measure cases, etc. And it's these sorts of things, it's just addressing the fundamental nature of humanity. And one aspect is just basically, we just pretend it's not happening or we can't do anything about it. So therefore, we need just to always be very active and just understand what is this plausible parameter space. And the other part really is what happens if I do versus what happens if I don't. Simple. And then again, not simple at all, because if you try to translate that into reality, it's a real headache.
Kim?
I think I would echo a lot of what Nick said. As far ahead as we could plan, bought the modelers more time to be able to build things and do things, because politicians and decision makers, not those within public health, but when you go up that next level, have no concept of time or patience. And so they're not paralyzed by, they don't have analysis paralysis. They'll make decisions or not make decisions with or without evidence. But giving that time for the modeling team to be able to do something that's better than what they would do if you just dropped 5 minutes to give them that, and understanding that boundary piece that Nick talked about as well, right? Like, this is how certain it is, this is what we can or can't do. And I think the worst thing I've seen is when people have tried to cobble something together to answer a question, and they didn't do a good job because they didn't have enough time, and then they got the exam question wrong, and then that erodes that trust. Which, if there's only one thing that I wish there was between the scientific community and decision makers, it's trust.
So you played a role of this middle person, right, between the modeler and the decision maker at the highest level. So is there hope?
Yeah, so that's very nice, Michael, to put stuff in there. So I think a little bit like Peter, I'm not really a modeler. Like, I've done it, but I'm not good at it, right? So I'm, not amazing, but I'm probably that jack of all trades and master of none, because I worked as a senior strategic policy decision maker with the government of Alberta. And then I got the opportunity several times with Dr. Hinshaw to brief cabinet and the premier. So the importance of that common understanding is the most fundamental piece. If I could reverse back to when things were a bit quieter in June and had time to really sit down, like June 2020, so that long ago, to go back in time and actually come to a common understanding and even bring together some of the modeling team with some of the senior decision makers. I think that would have been, in my time travel device, the best thing to have had happen. I think the going forward, so Alberta obviously has a unique experience. It's a difficult situation between the scientific community in general and elected officials. So it was very difficult to get a common understanding and to be able to do that. So I think we were great with public health officials, and then it kind of, that next layer was tricky. In terms of going forward, I think Dr. Tam had kind of mentioned this, as we move towards more of an endemic stage, depending on how we define endemic and what that looks like, I think that's a bit of an opportunity to reset some of the relationships where there has been a lack of trust, and try and do things a little differently. But certainly other jurisdictions, I think, who maybe have had more experience using models for longer have done a bit better. So BC CDC has produced modeling that their elected officials have seen before pandemic, like they kind of knew what it was. The first time we briefed the Premier back in March 2020, he'd never seen any of this. He didn't know what any of this was, and we brought him essentially a foreign language that he needed to process. And so I think, you know, that building up modeling capacity and having modeling as part of a public health understanding will be good going forward. Because unless you've worked in areas that have done modeling like antimicrobial resistance and other things, people just, they've never seen this before. And so, like you said, exponential growth of exponential curves, people didn't know what any of this was. So I think we kind of set the basis for going forward. So I'm a little bit more optimistic about the future.
So someone in the discussion is Luis Alvara Correa is suggesting that would an iterative system where you use the data you have, you put them in the model, and then you adjust. I think that's probably the ideal situation, right? When you can interact the model and the data and adjust. And this is, I think, to significant what Nick presented with the different waves, and the model was being improved and adjusted, right?
I think it depends on your objective here. I mean, we've looked at used dynamic modeling for two different purposes. One is the scenario-based modeling, which is to say, well, you know, like what will happen down the line if we get this variant is kind of more transmissible, less transmissible, if we have this number of people vaccinated, if this vaccine works this way, then that's the scenario-based modeling, which we do anyway. But the forecast has a very different objective, which is that over this next little while, we know enough about this that there's a limited number of options, which are basically, it will go this way if you don't do this, and it will go this way if you do this. And which requires that we've got a lot more confidence in to be able to bring that forward to decision makers, and for that to be presented to the public. You know, so that under those circumstances, I think there's a limited range. You've got to have enough confidence to be able to do that. Now, I have seen in some, and it was something that Beata alluded to, which was the idea of having kind of almost model ensembles. And I think that's a good approach. I mean, we have done that ourselves to say that if we have 2, 3, 4 models that are doing the same objective, there's different structures, but using the same best data, then we can say, well, is there something inherently, are these doing the same, providing the same thing? Or is it that one of the models is just wrong? Badly formulated, got a bug in it, I don't know. But I have seen some ensembles which have been, in my view, really unhelpful. They produce things where if they were I would never present those to my kind of decision makers, because there is 20 different futures, and every single one of them is different. So which one's the right one? Nobody knows. Sorry, Nick, I can't tell you. That's not very helpful. And there's only one reason really why you're going to get that variation, is that everyone's using a different model parameters, and some of the models are good and some of them are bad, but we really don't know which one's which. So there's a limit to how far that you can go down that road. You can do that in the back room, but and we do, of course, do that in the back room. But it's not something, you've got to be much more confident before you present that to a decision maker, I think.
Yeah, I think, when you think about this, the term consensus model is probably quite apt in describing how I experienced the modeling consensus table. It was very enriching, always to have all the colleagues on the table and then just look at the ensemble of models, Nick, that you were referring to. But then really, sometimes it becomes very clear when you then look at calibration. What are we doing, or what are you guys doing, essentially using these models? You first need to try to explain with your parameterization what you're seeing, meaning you need to carefully calibrate and recalibrate. And then you move a little bit into the future, and it may be that your prediction completely deviates from what you're seeing. And then you really need to be disciplined in just trying to understand, okay, I can tweak my model to make it fit and calibrate again. But if I do these tweaks, does this still correspond to our clinical, biological, or other, epidemiological understanding of the disease as it is? And this needs a lot of discipline, and this needs a lot of discussion.
Yes, I'm reminded of the framework of this ensemble of models, of the way I understand the Intergovernmental Panel of Climate Change operates. They do run a number of scenarios and models, and there's a consensus building. And really, it's not a model, it's not the model, but it's really a consensus of what, in all likelihood, because all the models pretty much unanimously point in the same direction, and they are validated, they are calibrated over and over. And I think this notion of calibration is possibly one area in which the use of mathematical models can be improved in such a way that they will be trusted by non-modelers, and people will not keep saying, as I've heard, well, you can put any number in your equations and you can basically decide what your predictions would be, which is not exactly how it's done, but that's how the perception goes. And so would you agree with the statement that lessons can be imported from other areas in decision-making, like emergency operations center? So would something like running emergency scenarios and doing like preparations for new pandemics be something that could be incorporated in the capacity building that was alluded to? So my understanding from your intervention is that one of the lessons looking forward is to have some forward preparation of the next pandemic or the next crisis that can occur. So maybe there would be less of real-time decision-making and more forecasting and adapting something that had been done. Is that something that you would agree with?
I'll maybe just go first and say yes, of course. We've got to build models that are somewhat generic so that we've got some modeling structures to start with, so that we're not having to start with a blank sheet, which was what we started with essentially for COVID. Secondly, building those models helps in an iterative process as to knowing what data do you need to go into them. In other words, what do we need from surveillance? What do we need from hospitalization data? What do we need from, and what information do we need in advance? Maybe the things that we can get by doing some pre-work to populate that data. And clearly there's a really big thing about how does the decision get to the people who need to know. That's a very specific organization thing, of course, but the idea that there is a direct line of sight between for modeling outputs to those people who need to know that output in peacetime and in crisis, then that needs to be established beforehand. And again, that wasn't, I don't think, from our perspective.
I have done EOC prep in the province many times in peace times, as Nick likes to say, and never once has the role of analytics or data or modeling ever been considered. It is much more, how does the operations work? And so I think there's probably an opportunity to revisit how we look at the pandemic and pandemic responses and the role of data and evidence and modeling, for sure.
You know, there's a time before this pandemic and there will be a time after when we all learned a really big deal, everybody. And it has changed the landscape, and we, at least, you know, for the next 10 to 20 years, we will not have forgotten everything we learned, and then it starts to fizzle out as usual. We're just humans, no? But the point is that I would hope that this time we really understood, you know, that all those people who warned us 10, 20 years ago, they probably had a point, and this time we really need to keep the capacity. This is like training for the Olympics. You can't just say, great, the Olympics are tomorrow, all good. You need to keep people trained. You need to keep them motivated. You need to give them playground, scientifically speaking, to play this out, etc. And we can't lose the expertise that we gained now. And I think what we really also learned is then how important it is, really the connection that both Kim and Nick just were referring to. This connection to the decision makers and to the public will be of utmost importance. You can't do public health and you can't apply models if everybody just thinks you're a fool. And it's as simple as that. They're just in their ivory towers and it doesn't matter. It matters absolutely, means we need to continue what we're doing now also in peacetime.
Thank you. I think this is a nice place to finish with peacetime, but the notion that, well, I'm reminded of this saying that civic pacem parabellum. So if you want peace, prepare for war. So I will thank the panelists and